Hi, so I'm going to discuss the difference in the types of veneers that we offer and also some of the veneers that are currently on the market. So, veneers, they come in very, very different materials nowadays and very different ways of making them as well as bonding them. I'm not going to go into this too much because it will become too long and boring. So I will just go through the bits which I think may be of interest to people. So I commonly get asked, what veneers would you prescribe for me? And it's really a difficult question because in a patient we sometimes end up doing different types of veneers within the same patient. So for instance, if we want to do a non-prep veneer, which I would say 90% of my veneers are, then we would do that in feldspathic porcelain, which is powdered porcelain. So it can be very thin, it can be very translucent, so it literally is invisible. But then if one of the teeth is discolored and it's already had a crown or something on it, then we would have to do something like with an Emax and then layer it with feldspathic. So it really depends on each individual case situation as to what we do. But I think what separates us from a lot of other places is that we specialize in doing pretty much non-prep veneers. And there's various brands out there that are so-called non-prep veneers, such as Lumineers. We don't use a brand. I just have my ceramist based in California who does all the veneer cases, and he's managed to make them super thin, 0.2 to 0.3 millimeter. And like I said, most of the cases are non-preparation. How many veneers does someone need? Again, that's really dependent on each individual case. It's dependent on how you want the teeth to look. I mean, the veneers, they can look supernatural. I mean, that's how we like to do our cases. Not too bulky. Of course, it's easy to add bulk to teeth if you're going to put a veneer on them. But one of the things a lot of patients come in and ask me is, we don't want that look of, horse teeth or really, really bulky veneers. And if you look on our website, on our social media channels, I don't think anyone could say that these veneers look bulky. They're very, very thin. And I think for us, or for myself, the best result is if someone doesn't even know you have veneers. But some people want them to be very white. That's possible as well. With feldspathic. So the veneers that I most commonly do are feldspathic veneers. That's basically powdered veneers, as in it's handmade. Nowadays, everyone's moving towards Emax, which is milled or pressed. But the ones that we do most commonly is feldspathic. It's just because you can get great translucency, great texture, and it just looks very, very natural. It's a dying art, so there's not many people doing feldspathic anymore. Most people are doing, like I said, Emax veneers. The other thing we do a lot of is if someone's a bruxist, so someone who grinds, then we'll do an Emax shell and then we layer it with feldspathic. And again, if you look online, a lot of our cases state whether it's feldspathic or a layered veneer, something that we're happy to discuss. So that's one of I think those are the most common questions we get asked. And of course, do you cut teeth? No, we don't. So we try to avoid that at all costs. One of the things I do a lot of is I do a little bit of orthodontic work, pre-restorative veneer work. So that could be anything from 7 weeks to 3 months, just to align the teeth better so that we're able to do a case with virtually no preparation. Other questions was, how do we differ from Lumineers? Lumineers is a brand of ceramics that a lab does. Ours is done by a very highly qualified, accredited American Academy cosmetic member, dentistry member, and basically the veneers that he does are super thin, and they are able to mask out dark teeth, discolored teeth, and such, because he's got the know-how how to actually block out teeth. That's something that you wouldn't be able to get with branded ceramic like Lumineers or something of that nature. So we've never used that. we've never used a brand before. We've just got our ceramist, and he's able to do all of this. So one of the common questions I get asked by patients is, how do we differ from other practices doing veneers? It's a good question. We are very different in our approach to veneers and cosmetic work in general. Every person should have a different design for veneers or any cosmetic treatment, because everyone's face is different. So you have to really look at the person's facial presentation, the shape of their face, their features, before you're able to design their smile. And that's something we spend a lot of time on through videos as well as photos. And that gets relayed to our technician. It's a fully customized service, and it just comes part and parcel for all our cases. So one person's veneers will never look like someone else's. And you may get the same color and translucency and texture, but the shape will be different because everyone's face is different. So that's where we really try to make sure that everything is done in a very specialized manner, where it's fully customizable. So that's the real difference. And the other thing we really focus on is just non-cutting veneers. We really don't like to cut teeth. We have a lot of technology which is able to assist us with that. We have a laser which removes veneers without damaging the teeth, and we're able to use that in cases where we have to remove veneers. So laser is something that we use very often. It's a water laser, so it's able to fulfill the task of removing veneers without cutting the teeth. And the other thing that we use for pretty much every case is a microscope. So we're able to see in much more detail where the tooth finishes, the margins, as well as if you're having to remove a crown or something, you're able to see the cement very clearly. So all of these things really help us give a really lifelike and fantastic result. So this is something you can see on our website and our social media channels, and you're able to click and ask any questions to our team.